And welcome to Waco City Hall, where we're conducting our weekly press conference on the COVID-19 pandemic. I'm Larry Holsey, Director of Municipal Information and Communication for the city. I'll be the host for this particular part of it. In a moment, I'll introduce our panel and everything, but I want to let you know how we're conducting this. We only have two people in this nice conference room. It's Julie Olvera from the City Secretary's office is handling all the Zoom technology. And downstairs in our studio, our TV studio on the first floor of City Hall, we have an American Sign Language interpretation being recorded that will be changed and added to our picture as you see it now in the far right-hand corner for all of our people who need those services. And we're also recording a full audio track in Spanish in that studio as well. That will be replayed this afternoon at 4:30. And join us today. I'm very so welcome back our Mayor Pro Tem and District 2 Representative Hector Sabito to do an interpretation, but a Spanish interpretation to those persons who need and want to hear this press conference information in Spanish. Hector, glad to have you back, and would you please invite our Spanish speakers?
Sure. Larry, thank you so much. It's great to be back. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again for the invitation.
Well, thank you so much. I appreciate you so much. Well, joining us today for our panel is, first of all, our Mayor, Dylan Meek. I almost made a mistake there, Dylan. Such a habit there, Dylan Meek, our Mayor. McLennan County Judge Scott Felton. Dr. Jackson Griggs, CEO of the Family Health Center. Dr. Richard Haskett is helping now from Ascension Providence. Dr. Haskett, glad to have you here. And Dr. Mark Eliason back from Baylor Scott and White Hillcrest. Welcome, gentlemen. Thank you again for being a part of this because your information is always so vital. We'll start off in just a moment with introductions and let you all have an opportunity to make comments, and then we'll answer the questions, propose the questions that we've received through the last week or so from the media and other places. And then we will open it. We do have, I think, 3 or maybe 4 representatives from media that will be coming on the Zoom live, and they'll ask, we'll do 2 rounds of questions. Hopefully we'll get each one of them have a chance to get 2. So let's start off with opening comments. We're going in the order of Dr. Jackson Griggs first from the Family Health Center, followed by Dr. Richard Haskett, Ascension Providence, Dr. Mark Eliason from Baylor Scott and White, and McLennan County Judge Scott Felton, then Mayor Dylan Meek. So Dr. Jackson, would you start us off?
Yes, thank you, Larry, and thank you, Mayor, Judge. Start off with numbers. Worldwide, there have been 64 million cases to date of the novel coronavirus. There have been over 1,484,000 deaths to date due to the disease. In the United States, there have been a cumulative total of 13.7 million coronavirus cases and 271,000 deaths from COVID-19. Texas has seen 1,184,000 cases and 21,549 fatalities. And McLennan County, this is the update as of this afternoon. The total number of confirmed cases is 14,672. 803 of those are currently active. As of yesterday afternoon, the Public Health District received notification of 141 new cases of coronavirus. So I said as of yesterday afternoon, it's incorrect. It's as of today, this afternoon. So that's today's update. We've seen 141 new cases of coronavirus. 104 people are currently hospitalized with COVID-19, and 19 of those who are currently hospitalized are receiving ventilator support. We have seen 5 additional deaths, and that brings us really to another painful milestone in our community. We have crossed the the threshold of 200 total deaths in McLennan County due to COVID-19. We're now standing at 203 total deaths in our community due to this virus and this disease. Among the community-wide surge testing, the total tests to date are 28,866. The positivity rate from the surge testing is 9.5%. Within elder care facilities in McLennan County, there are 17 current facility outbreaks. There are 145 active cases among patients and staff in these facilities. And there have been 78 nursing home associated COVID-19 fatalities to date. There are 2 active cases in the county jail. There are 14 independent school districts and 6 private schools that are reporting cases on campuses. And there are a total of 52 school campuses. So the 14 independent school districts and 6 private schools are the school systems themselves, but there are 52 school campuses, individual campuses with active cases. And within schools, there are 142 active cases, and among those 142, 73 are students and 69 are staff members. I'm going to share my screen and present the numbers in the United States, Texas, and McLennan County graphically here. So I'll just go ahead and preempt what you'll see, and that is a steep decline in numbers occurring in the Thanksgiving holidays. That's because a lot of testing facilities weren't available and or individuals weren't using the tests at the same rate during the holidays. So I would just take some measure of caution in interpreting the data that I'm about to show and not to overinterpret the decrease in cases and assume that that reflects a decline in the incidence of disease, the actual incidence of disease nationwide, statewide, and within our county. Remember, this line graph describes new cases that are diagnosed per day on a 7-day rolling average per 100,000 in population, so that we can compare populations. So you'll see here in the United States, we are at 50 new cases per day per 100,000 in population. In the state of Texas, we see now 36 new cases per day per 100,000 in population. And in McLennan County, 29 new cases per day per 100,000 in population. Again, please take these numbers with a large grain of salt. We will see in the upcoming days the numbers begin to have more, I think, of a meaningful trend line than what we've seen over the past 7 days. And this is just a reminder where we are when we overlay Harvard's Global Health Institute thresholds for spread of the disease. We are still well within that tipping point red zone. In terms of positivity rate, right now the state is at 9%, McLennan County is at 13%. Again, we expect to see some variability on positivity rate as we catch up from the holidays. Mitigation is below 10% positivity rate, and full suppression of the virus occurs when a community is at 3% or less positivity rate. So we're quite a ways away from that threshold. This is a snapshot. This is the based on yesterday's data. McLennan County might have broken the 40 current hospitalizations per 100,000. I did not update this slide since yesterday's numbers. But what you see here is that in the United States, there are 29 individuals hospitalized per 100,000 in population. Texas, 31 per 100,000, and McLennan County, more hospitalizations per capita than the state or the United States by a fair measure. So, brief recap on what can be done. Wearing masks over the nose and the mouth every time you're not with household contacts. Spending as much time as possible at home until the surge subsides. Avoiding dining and drinking inside a restaurant. For those who are restaurateurs and small business owners, keep driving by, keep picking up food from those restaurants for our community's economic sake, but it's best if you're not eating indoors right now. And remember to maintain 6 feet distance from all non-household members. And then if you traveled or convened with non-household members over Thanksgiving, a couple of additional recommendations. Get a viral test 3 to 5 days after travel or after gathering. If you get tested before that 3 to 5 day mark, you're more likely to get a false negative result on your test. So wait those 3 to 5 days after traveling or after gathering before you get tested. Reduce any non-essential activities for 10 days, just in case you did get the virus while gathering or traveling. If you reduce your activities, if you're not out and about, then you're less likely to be a vector, a spreading agent of the virus. And then finally, just screen, kind of take a personal inventory each day. Do I have a sore throat? Am I feeling more tired or fatigued? Do I have a little bit of a dry cough or short of breath? Did I have any night sweats? My body aching a little more? And if you have any symptoms, even subtle symptoms, please go get tested immediately. That's all I have as far as introductory comments.
Okay, thank you very much, Dr. Griggs. Dr. Richard Haskett with Essential Providence. Dr. Haskett?
Good afternoon. My name is Rich Haskett. I'm an obstetrician gynecologist from here in Waco. Currently, I'm the Chief Medical Officer of Ascension Medical Group, which is our clinic system here in Waco, and I am a Vice President of our network. Mayor Meek and Judge Felton and fellow team members, very glad to be a part of the conversation, and I think I'll hold the details until we get into some of the questions, if that's okay. Pass the mic to the next person on the panel.
Okay, thank you, Dr. Haskett. Dr. Mark Elyson with Baylor Scott and Wyatt Hillcrest. Dr. Elyson?
Yeah, good afternoon, and thanks for having me back. As we can see, COVID has not gone away with Thanksgiving, unfortunately, and it remains a problem. I appreciate Dr. Griggs for those words of wisdom, and would like to just repeat some of those for emphasis, because those are important. And this won't be the first time we've repeated those comments. We've been saying a lot of those things for weeks and months, but I still think it's important to say some of those things and to underscore some of the important aspects. So masks, again, are of vital importance. And a mask that covers both nose and mouth. We've all seen the nose hanging out of masks as we are out in the community, and that's just ineffective, and it's not going to protect you or them. So
Judge, McLennan County Judge Scott Felton. Judge?
Good afternoon. In 2020, anything can go wrong. Generators go down, everything else could go wrong. So we're getting used to it. I apologize about my hoarse voice. I'll try to speak up. On October the 7th, the governor issued an order called GA 32, and it pertained to restrictions around the COVID-19 pandemic. In GA 32, the community was allowed to increase occupancy in restaurants, businesses, and other things, also given the option on a county by county basis. If they want to open bars, they could. This is all subject to the occupancy of COVID patients to the total beds in hospitals being 15% or less than 15%. This past Sunday, I received a letter from the Department of State Health Services notifying us, because our percentage had exceeded 15% for more than 7 days, that we were to roll back those orders to reduce the occupancy in restaurants and businesses to 50% of their certified occupancy, which is determined primarily by the fire marshal. So almost all buildings within a city will have that designation, and so that's how the calculation is done. Also, the counties can no longer allow bars to be open, so those would be closed as of Sunday. There are some specific questions around that order that I noticed are coming up, so I'll save my response and my voice to respond to those questions. Thank you.
Thank you. All right, Waco Mayor Dylan Meek. Mayor Meek?
Good afternoon. This week, many in Waco are transitioning from celebrating Thanksgiving to celebrating Advent. And it's my hope that Wacoans embrace some of the major themes from both of these seasons. In 2020, it might seem difficult to meditate on the ideals of Thanksgiving and hope, but I believe engaging in such things are a worthwhile exercise. We're going to engage in some pretty heavy discussions today in this press conference, and already have, but in spite of the difficulty of this year, I believe there is still hope to be found and thanks to give, including thankfulness for our doctors, our nurses, and healthcare providers. If you know a nurse or a doctor or a healthcare provider and are watching this, I encourage you to text or email them right now, thanking them for what they're doing. Their sacrifice, their families, the sacrifice that they're making, the sacrifice that their families are making are significant, and our encouragement to them is valuable. Julie, if you would pull up the slide that I submitted, I just have one point of data that I want to focus on today, and that is hospitalizations. In the last week, we have surpassed 100 COVID hospitalized patients, hitting 101 on Monday. This is an all-time high. Even in the peak of the summer, the most hospitalizations we had on a single day was 78. And I want to highlight that because hospital capacity is something that we're continuing to monitor here closely. Julie, you can exit that slide, please. Our Office of Emergency Management, as well as other community leaders, are talking to our hospital systems every day, and I know that the representatives of the hospitals on this call can answer some of the questions that might come up regarding capacity, but I want to say how much I'm thankful for the strategic and hard work that our hospital systems have done to make sure that our capacity concerns are being met. For the sake of the community members that are at higher risk of severe illness or death or hospitalization, and in order to reduce hospital capacity, this is a time that we really do need to up our game and reduce and exercise higher levels of caution going into this hospital season. Our current hospital capacities are creating tiring conditions for doctors, nurses, and healthcare providers. And while at this moment there's no reason for alarm, there is reason for watchful concern over capacity and exercising caution by limiting gatherings, washing our hands, wearing masks, as Dr. Griggs and Dr. Eliason have already spoken on. These are things that we can do to increase hospital capacity and reduce the number of hospitalized patients. It's true that our hospitals have increased their ICU capacity in March, but this is not unlimited. We are in a country that believes strongly in our right to make our own decisions, and I believe that, but we have to recognize that our decisions can affect others. And there is something we can do to increase hospital capacity. There is something we can do to support doctors and nurses. We can wear masks. We can limit our gatherings. There's something that we can do to make sure that our hospitals have capacity to accept new patients in critical need, whether that be COVID or otherwise. You can limit gatherings. You can wear masks. I don't like wearing masks, and I'm an extrovert, and I like going to parties. But at this point, there's a couple of assumptions that we need to make, and that's one, we need to assume that anyone we come into contact with is asymptomatic and has this virus, and number two, that the more precautions we take, the more we're able to protect hospital capacity. And I think that we need to heed the advice of these local doctors on our call today and in our community that are encouraging these safe practices. As a reminder, at the present time, Texas mayors and local governments have almost no policymaking authority. And Governor Abbott has implemented and has control of regulations and mandates from wearing masks to closures, and including the adjustment that was made even this last week with regard to capacity. That's all in the hands of the governor, and I know that we're going to talk about that a little bit more in this press conference. There's something else I'd like to state in this press conference, and that is that the Waco McLennan County Emergency Management Office have preemptively requested and received a refrigerated trailer from the Capital Area Trauma Regional Advisory Council to be used as a temporary morgue. The trailer will be staged in McLennan County due to the increased number of cases and hospitalizations. Currently, local mortuaries and funeral homes have the ability to meet demand, but it's important to have a trailer like this before it's absolutely needed. The health district will continue to communicate with local funeral homes and mortuary services regularly to discuss the most up-to-date information and needs. The trailer will be staged at an undisclosed location, and although local mortuary services are not at capacity, there has been an increase in usage. With the continued rise in hospitalizations, there is a risk for an increased number of deaths, and we do have data from other communities in Texas that we can track to really identify when to best understand when needs such as this will occur. The increase in deaths usually occurs 2 to 3 weeks after cases and hospitalizations. Again, we've reviewed data specifically from El Paso. This trailer will have 40 spaces. Other cities have used prisoners or the National Guard to assist with fatality management, but the local mortuary services have indicated that there's enough staff to handle any increases in facilities. So again, these are some heavy things that we're talking about, but in spite of the gravity of this, I still believe that this is a time for hope. More positive news comes out daily regarding vaccines, and Waco is hard at work to ensure we are prepared for vaccinations. Our Office of Emergency Management has been doing much work already to learn about the vaccines and make plans for the distribution to our community. As I mentioned last week, the Office of Emergency Management is assembling a vaccine planning coalition that will include healthcare providers and entities that are registered to be COVID-19 vaccine providers, jurisdictions with critical infrastructure personnel, and first responders like fire and law enforcement, EMS, and congregate care settings like long-term care facilities and jails. This coalition will work to ensure that there are enough and appropriate vaccine providers enrolled, discuss logistical needs of enrolled providers, establish an understanding among priority vaccine candidates regarding who will be vaccinated, priority and uptake estimates, where they will be vaccinated, advocate for just and equitable distribution as well. In the last 8 months, we have learned so much about how to take precautions against this virus. Smart, safe behavior allows us to go about our lives without fear. and I encourage us to exercise caution and wisdom in the days ahead. My prayers are for our city, and my confidence is that good days are ahead.
Thank you, Mayor Meek. That was very tough information to have to share, but thank you for sharing it in the way you did. All right, let's go to the questions. We have a number of questions. We'll try to get as many as we can, and I'm going to pitch them out there, and then you all, Mayor, you'll decide maybe who should best answer. The first question I have is late last week, Texas Health and Human Services sent out a letter to Judge Felton requiring businesses and restaurants to reduce capacity in bars to close. What is the scope and actual impact of this order?
Judge Felton, you can field this one.
Okay, I'll get into a little bit of detail on what the impact is. As I mentioned earlier in my opening comments, that the occupancy of a business is set generally by the fire marshal. And for businesses and manufacturing, they cannot count, or they do count their employees in those numbers. But in restaurants and retail businesses such as department stores and those things, they do not count those employees in that occupancy number. In talking to and actually reading in the Trib a interview with Kyle Sotrano, the president of the Restaurant Association, they said that they were already at about 50% capacity because they cannot, they have to keep 6 foot apart, and they could not do 75% and keep that safe distance. So I think they've already been there. So the impact to them is going to be little. But retail businesses, it could be, a larger issue. But we've all been there before, and so I think that you'll see a quick adaptation to the rules, and people are trying to comply with it. There again, if you're a patron or customer of these places, you need to really assess whether the place that you're going into provides adequate amount of safety to ensure that you're able to use their services in a safe way. Thank you.
Okay, follow up kind of on that same thing. How are businesses being impacted by the governor's order responding to this news?
I think Judge Felton basically covered this, but one thing I would add that I'm really thankful for is we have a team of business stakeholders and support organizations like our Chambers of Commerce, Startup Waco, and the Business League, and others who have banded together and formed a business recovery working group. This has been going on since March. Councilmember Jim Holmes and Sarah Roberts, who's the president of the Business League, this year are chairing that organization and working with all of those stakeholder organizations to make sure that businesses have an understanding of the rules as well as the support that they need. We also, the city was able to set up a small business recovery fund to support businesses throughout this pandemic. I do know that Sarah and Jim, I've spoken with Sarah and Jim, and they're continuing to, with this new adjustment, contact, reach out to businesses, see what needs might be as a result of this, and make adjustments as they need to, and meet those needs as they're able to.
Okay. How many bars are reopening under the guidelines for restaurants, and how will the city make sure bars are actually following those rules?
I'll start with this, and Judge, if you want to pick up anything I leave out, please feel free to do so.
Okay.
As of November 30th, according to the TABC, we have 466 businesses that are classified as restaurants. The city continues, the question's about city compliance, so I'll respond to that. The city continues to respond to complaints and violations and investigates each complaint. Upon a visit and an observed violation, the business will receive a warning. Continued observed offenses at an establishment will result in citations. Staff will investigate the establishment for an occupancy issue and provide a copy of the governor's order if a complaint is made. And if an occupancy issue is observed, staff will request the owner to refrain from letting in additional customers into the establishment and work through the current customers inside until the occupancy limit is reached. At the first visit, the business will only receive a warning. We definitely want to work with businesses and at the same time honor the governor's order per his request that we do so.
I would just add that I have not been able to determine how many businesses are just bars only. I've asked the TABC that question and have not got an answer to that. We think it's a very small amount. Many have already converted to both, the option to sell food and expand their services. They have to meet the same requirements that restaurants do. In regards to violations with bars, the governor has charged the TABC to be in charge, to be head of the investigation of any violation of those rules. And it's my understanding that they have a pretty big task in front of them with a lot of investigations going on. But I don't have any idea about how many bars might be under investigation right now. They're in danger of losing their license, which is a pretty big punishment for them. So I feel like they'll make every effort to try to comply.
Okay, hospitalization rates continue to climb. What are current concerns over capacity of both physical space and personnel, and plan to address this?
Dr. Haskett or Dr. Eliason, do you want to fill this one?
Sure, I'm happy to go first. Well, we're busy. I think that's the bottom line. We are busy, but we currently do have the capacity to treat all patients at Ascension Providence, and most importantly, pursuant to this conversation, our COVID-19 patients. I'd like to reiterate what Judge Hilton and the mayor in Jackson have said about the increased rate of hospitalization that we have. It is real, it is noticeable. What are we doing? Well, I think the first thing we'd like to remind the community is that we are a system, not just a hospital. So we have a robust array of interventions that are designed to take care of our people and to hopefully take some of the pressure off of the hospitals. For example, our drive-through testing centers have been up since the beginning of this, our park and go testing, our park and go evaluation and treatment. We have a very robust home monitoring system that allows us to take care of patients that several months ago would have required hospitalization, but to do it in a safe and timely fashion, transition them to hospitalization if we need it. We're currently exploring bringing BAM antibody therapy to this community. We're very excited about this, and hopefully within about the next week or so, we'll be able to offer this to patients with COVID with mild to moderate disease, and hope that we will prevent progression to the more severe disease that would otherwise require and currently require hospitalization. We're bringing in travel nurses. We have about 28 of them, if my memory serves me correctly, that are coming in with specific expertise in COVID. They'll be transitioning in over about the next 4 weeks. What we do find is we have beds and ventilators. We've certainly been planning for this surge that we all hoped would never happen. But we are having to pay careful attention specifically to our nursing personnel, and we are addressing that proactively.
Yeah, similar comment at Hillcrest, Baylor Scott and White here in Waco. We also are experiencing an increase in hospitalizations. There's no doubt. We're seeing a lot of patients that would not be patients in 2019. And unfortunately, these are very sick patients who come to the hospital and require lengthy periods of time in the hospital. 3, 6, 7, 14, 28 days. These are very sick patients. And it is putting a strain on healthcare and our providers and our nursing staff and beds. But at this time, we still have capacity. We still have space. We still have supplies. We still have ventilators. We have also brought in some agency nurses who are assisting with some of the care. But for months, we have been planning as a team, as a system. So it's not just our hospital alone, but working in tandem with Ascension Providence as well as other hospitals within the Baylor Scott-White system. Should we reach that point where we can no longer manage the patient load, but at this time we have space to care for patients with COVID-19 and without COVID-19. And we are continuously anticipating changes to that, and we have several layers of surge planning and kind of pop-off valves should we need them. And we are also working closely with the community to make sure that we're able to provide care for those patients.
Kind of a follow-up on that surge part. What hospitalization rate would indicate it's time to start opening surge sites for COVID-19 patients?
Dr. Lyson, do you have any indicators on that?
Yeah, it's when we run out of space. And right now we still have space. So we are not there yet. But even within our own hospital, we still have space to expand. And we have, as I mentioned vaguely, but we have plans in place for where we can put patients should we need to. I know it's kind of vague. I'm not answering the question directly, but we're just not there yet to where we have to jump out of the hospital. But the answer is when the hospital is full.
Dr. Haskett, do you want to field that question?
Sure, happy to. Definitely agree with what Dr. Elyson said. We are busy. We still have capacity, and we have been doing a lot of planning. Of course, as Mike Tyson said, everybody has a plan until you hit them in the mouth. And I think we as a community are suffering that and learning every day. But I do think we're getting better every day. As a native Wacoan, I am, my heart is warmed, and I don't even have the words to express how happy I am with the collaborative nature of the way that our teams have come together in healthcare and with city and county leadership. I would guess that nobody is doing this in a more collaborative fashion than we are. So yes, we're humble in understanding that this disease is rampant and expanding, but I am very bullish on the fact that we will continue for the foreseeable future to be able to take care of our patients. Should that need arise, I think this will be a collaborative communication and work process, both with our partners at Baylor Scott and White Hillcrest and with FHC, with the city county leadership, but of course as a part of Ascension Texas, which is a robust and vital organization that is able to come in and help us if we have the critical need for such help.
It's the next question.
All I would add to that is that I'm thankful for our Office of Emergency Management, who have worked in collaboration with the hospitals to develop multiple plans for multiple situations, and are monitoring data daily to ensure that our community as a whole and all of our stakeholders are prepared for a variety of situations that we hope we don't come to, but in the event that we do, preparations have been made and are continuing to be evaluated and tweaked as necessary.
Well, I'm going to read this question, even though I think it's been answered, but I think it probably just justifies a yes or no answer by maybe the doctors. Should local citizens be concerned that any patient needing critical care other than COVID be turned away from the hospital? Should they be concerned? Yes or no?
I would say absolutely no concern. Patients will not be turned away.
I would say no, but I would also say to our communities that you have a part in us being able to say no. You can help us by doing the things that have been asked. And most importantly, if you think you've made a decision that some of what you've been told is political or not true, I would ask you to reach into your heart and rethink that. A lot of people have chosen factions based upon masks or no masks. It's unfortunate. And it's also not true. The masks, the distancing, what we're doing does help, and you can play a part. And us both continuing to say, yes, the doors are open with no problems whatsoever. it'll have to be collaborative for that answer to continue.
Okay. Are Hillcrest and Ascension still doing elective procedures?
At Hillcrest, we are. That could change. All it takes is one day of lots of admissions to fill up. But because we still have capacity to manage our inpatient volumes of patients, COVID and non-COVID, we still do have capacity to care for elective cases. But as I said, that is subject to change should things become more serious.
I had to admit that out of an abundance of caution, we have opted to put a temporary pause on some of the most elective, most non-emergent cases. We have made that decision as a senior leadership team here in Waco and within Ascension, Texas. And we expect that decision to hold through this week and through next week. We are, as Dr. Elisa said, continually reevaluating our ability to take care of patients. But to remind the town, we're not just taking care of COVID patients. We are taking care of people that have heart attacks and strokes and cancer and all sorts of number of things that continue to vex our community and to come into our hospital. And we simply have to balance the needs of all those patient populations. It's a tremendously difficult decision to make, so disruptive to somebody to have their surgery planned, to have the COVID test that we're requiring, to disrupt their days. It's the end of the year, your co-pays may be paid. We're hoping that we can come to a different decision at Providence. For now, we're having to be very cautious because of the numbers that we're seeing.
Okay. Will the CDC reduce quarantine time recommendations, and what is the impact of this on business and individuals?
I actually think that's happened this morning. Dr. Griggs, do you want to speak to that?
Sure. Yes, absolutely, Mayor. The CDC provided a briefing this morning that our health district attended, and I checked the CDC website to see if it was posted a few hours ago, and it was not. But then I just received a phone call before this press conference from our health authority and infectious disease specialist, Dr. Farley Werner, and he said that he thought it may have been posted, but the CDC still recommends 14-day quarantine period as the best way to decrease spread, but they also provided 2 alternative periods that can be used if the local health authority deems appropriate. And in conversation with Dr. Werner just before the press conference, he stated that he did believe that it was appropriate for our community to embrace these 2 new quarantine time periods. So let me describe what they are. Quarantine can end after 10 days of exposure in an asymptomatic individual who is not tested. So remember, previously 14 days, well, now 10 days in an individual who is not tested during their quarantine period. Or after 7 days from the day of exposure in an asymptomatic individual and a negative viral test performed on or after day 5. Remember that before day 5, you might get a false negative. So day of exposure plus 5 days can be the day of test. On or after that day, if that test is negative, then quarantine can end 7 days after exposure. Now, let me clarify on the timing, because this is often an area of confusion. Day of exposure is day 0. It's not day 1. So day of exposure is day 0, and then you count 1, 2, 3, 4, 5, 6, 7. If on or after day 5 you're tested and it's negative, or 8, 9, 10 if you're not tested, and it is not on day 7 or 10 but that you break quarantine. It is after that day 7 or 10 that you're able to break quarantine. So again, day of exposure is day 0, count out 7 if you're tested and it's negative at 5 or later, or day 10 if there's no test. And after that day of 7 or 10, then you can break quarantine and be done with the quarantine period. But both of those periods must be combined with ongoing monitoring for symptoms the entire 14-day period. So what does that mean? It means continuing to check your temperature and to be very sensitive to your own physical symptoms. And if you see any symptoms all the way through that 14-day period, go get tested. Now, this is outside of the CDC's recommendation, but at this point in time, given the extremely high prevalence, any symptoms for anybody indicates the need for a test. But sharing specifically the CDC language, the symptom monitoring through the entire 14-day period. So what is a viral test? Either PCR or antigen testing during that quarantine period will suffice. Again, day 5 or later. If you have a negative antigen test or a negative PCR test, then at day 7, you can end quarantine. In conversation with Dr. Werner, he did mention that if we do face future testing shortages, that it might be prudent, and he would of course retain the authority to eliminate the 7-day testing end quarantine option so that tests can be preserved for individuals with symptoms. So a little caveat, Dr. Werner does retain that authority, but for the time being, he's ready to allow our community to accept this alternate quarantine methodology of 7 days or 10 days as described. And then the final question, I think, was what will the impact of these changes be? Certainly shortening the quarantine period makes it easier on everyone. We hope that with a little less onerous quarantine period, the community will be more adherent to the quarantine guidelines and not take personal liberties, understanding that the timeline is shortened, that individuals won't make exceptions for themselves to just go run this one errand or just interact with this one individual outside their home, but that will the community will not see these new guidelines as a signal that quarantine can be taken in a relaxed manner, but instead quite the opposite, that with the shortened quarantine, that our community members who need to be quarantined will perform quarantine in this expected and strict fashion.
Okay, thank you. I'm going to combine the next two, and then that will be our final question. How is the PPE supply holding up at both hospitals, and how are the hospital staff holding up?
Dr. Lyson, you want to jump in there?
Yeah, so we're good on PPE. Much of our PPE is recyclable, so gowns are washed and recycled and used again. Gloves, we have plenty of gloves, and masks we're in good shape for now. So we're good on PPE. And as far as staff, I would say we have good days and we have bad days. We certainly celebrate when we have patients who have been on a ventilator and who make it off successfully and who improve and then go home. And we have lots of patients who come in and go home. But, we also have bad days when we've taken care of somebody for several weeks or maybe even a month, and they pass away on our watch. And that's incredibly distressing and troubling. It's not something that's entirely new to us and our skill set, but it is still difficult. But we've got a strong team. We've got strong people who have been doing this for a long time, and we are managing. But yeah, just keep in mind, though, that this is not going away. We all want it to go away. We wish it would go away soon. But we are working cohesively as a team and supporting each other.
Dr. Haskett?
Yes, sir. Our PPE situation is holding up well. We continue to be proactive in maintaining relationship with distributors, suppliers. We're blessed to be a part of a regional and national organization that has the ability to make intra-hospital inventory transfers. So I think we're grateful to be a part of Ascension, and that has provided us quite a bit of peace of mind that I don't know that we would have if we were not a part of such a great system. And I'm sure Baylor Scott and White, we're grateful for them to be able to help our local hospital friend as well. As far as our staff, I mean, they're exactly as you would expect them to be. Good days, bad days. Ironically enough, there was a lot of beginning of this, before we had a lot of sick people, there was a lot of support your health giver and a lot of signs and a lot of people remembering in ways that we had really never been acknowledged before as a healthcare system. We just always kind of been there, and that was enough. And we were grateful for that. But now, just like the community is tired, just like those of you that are watching this are no doubt tired, we are too. We wanted to have normal Thanksgiving just like anybody else did. We wanted to have normal Christmas. We wanted to go to Christmas Eve service. We want to open presents. We want peace. But it is a difficult time. And so if you know somebody that works in healthcare, just acknowledging that would probably be a good thing. This is our time, and I know the healthcare system in Waco, Texas is more than ready, willing, and able to meet this challenge. That doesn't mean that there's not occasional bad days, and people could usually require and be grateful for a little acknowledgement or maybe just a text.
Okay, thank you all. We're going to go ahead.
Maybe a text with no expectation of reply. I'm thinking about how busy they are, and yes, please encourage your friends who are healthcare providers, nurses, medical assistants, anyone who works in healthcare. But you might even say no need for text reply or something along those lines, so they don't feel the burden of I've got to get back to this text, and because they're pretty stressed.
Thank you for that, Dr. Griggs. That's great. All right, let's move. We have 4 representatives from the media that have signed up to be a part of our conference today. We have Drake Lawson from KWTX Channel 10, Rhiannon Sagert from the Waco Tribune Herald. We have Jasmine Caldwell from KCN Channel 6, and we have Shaquille Omari from Fox 44. And we're going to go in that order. And as I call your name, unmute your microphone, please, and ask your question. We'll do 2 rounds, 1 question each time. We'll start with Drake Lawson from KWTX Channel 10. Drake, are you online?
Yes, sir. Larry, can you hear me okay?
Hear you fine. Go for it.
Perfect. I have a question for Dr. Eliason and Dr. Haskett regarding something you touched on a little bit earlier with the elective surgeries. I know that with elective surgeries, there is the option to have surgeries done maybe at elective surgery centers outside of the hospital. Will that still be open for people who would typically get it at Ascension Providence, or are all of the elective surgeries going to be going to Hillcrest? How is that going to work out for somebody who maybe needs to get, some shoulder injury repair done this week or next week?
So they are taken on a case-by-case basis. So we have an attestation methodology, and if there are extenuating circumstances, we, as a leadership team, are able to evaluate those on behalf of the patients and our doctors. So thank you for asking that question so I can clarify that. We also have a relationship with Fish Pond Surgery Center. Many, if not the majority of our surgeons, hold privileges at both our hospital and at Fish Pond. And I have no doubt that there will be cases, some cases that will go to Fish Pond to meet the needs of the people. Does that answer your question?
Yes, sir, it does.
And I think, at least for Baylor Scott and White Hillcrest and perhaps for Ascension Providence, the concern isn't so much that, getting patients in and having the surgery done. The concern is if we don't have enough nurses or capacity within a facility and we need to draw those nurses in to help care for other kinds of issues like COVID patients, that they're available. And we can flex them into those capacities. So it's something that we are continually assessing. and it could change. But for the time being, we are still proceeding with elective surgeries.
Okay. Thanks, Drake. Hang on the line. We'll be back to you in a minute. Rihanna Sagert from Waco Tribune-Herald. Rihanna, you on the line?
This is about contact tracing. How many outbreaks so far have been traced back to places of worship? Do we know?
Yes, I can answer that. Since the beginning, we've identified approximately 15 churches that may have been a potential source of the spread. Upon identifying a cluster, which is defined as just 2 or more cases associated with one church, the health department will contact the church, or the health district will contact the church to provide guidance on control measures and current practices in place. We also recommend testing for the close contacts. The area churches will be able to provide details on their mitigation protocols.
Okay. Thanks, Rihanna. Stay on the line. We'll be back to you. Jasmine Caldwell from KCEN Channel 6. Jasmine, are you on the line?
Yes, I'm here. When will we see vaccines arrive in McLennan County? And will they come at once, or will, certain hospitals get them before other hospitals, or how would that work?
Well, why don't I take a stab at this, and then if anyone else wants to come in here and clean up anything I mess up or miss, feel free to do so. The health district is working with healthcare providers. Can y'all hear me?
Yes. Go ahead.
The health district is working with healthcare providers and the DSHS to plan the logistics of the vaccine distribution. Once vaccines are authorized, there will be a limited supply at first as manufacturing and distribution ramps up. Initial doses will be allocated most likely for critical populations, including healthcare workers and other essential workers, and people more likely to develop severe disease like older adults or those with underlying health conditions. Texas COVID-19 vaccine allocation guiding principles and healthcare workers definition is posted on the COVID Waco website, so there'll be some more information there. The amount and the timeline will depend on when a vaccine is approved by the FDA. An FDA advisory committee will review Pfizer's data on December 10th and Moderna's on December 17th. As of November 30th, more than 6,600 locations have enrolled to be a vaccine provider in Texas. More than 4,100 providers in more than 225 Texas counties have enrolled with DSHS, and an additional 2,500 Texas locations of national pharmacy chains have enrolled directly with the federal government.
Okay, very
Does anyone
good.
else have anything else to add to that?
I think that was very, very, very helpful, Mayor. And I was actually taking mental notes while you were sharing because it was valuable intel. I do think it's important to delineate the different organizations that are involved here. And just as a matter of clarification, the Centers for Disease Control have a committee called the Advisory Committee on Immunization Practices, the ACIP. And